If you're joining us now live on YouTube, thank you very much. We appreciate your support. And feel free to share the link with someone else, because I guarantee you they will find some benefit from this discussion and the information that we're going to be sharing. So for the record, my name is Jonathan Jones. Today is April the 20th, 2025, and it's my pleasure and privilege to be your host and moderator for today. April has been declared National Stress Awareness Month. That's the right sentence to come out. So April has been declared National Stress Awareness Month. And that being the case, we get a chance to take a look at some of the details behind this matter of stress. And we're going to uncover exactly how serious it is and why it's so serious. And we'll hear from Dr. Prasad as he explains to us some of the reasons why stress has an impact on the body, and how it can lead to other things like oxidative stress. But let's talk a little bit of the background of the subject matter first. We are obligated to make sure that you know that the FDA has not evaluated the statements that we're making. So you're going to be hearing some testimonials. They're purely anecdotal. Results are atypical. That means that what happens to one person may or may not happen to you. So none of us, the Healthcare Support Association of America, Engage Global, Jonathan Jones, Dr. Prasad, none of the authorized representatives, hosts or co-hosts, are making any claims that these supplements that we talk about treat certain disease. So we have to try to make that clear to you so that we don't give the impression. We can't mislead you that way. Yeah, I see my microphone switched back and forth. But anyway, we got the disclaimer there that's done. So the presentation is for information and educational purposes only. It's not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. So, what is stress? It's what I'm going through right now with my equipment not working right. But it's not causing me anxiety, so that's actually kind of a surprise. But the definition of it is the body's response to any demand or challenge. Short-term stress can be useful in survival situations, but chronic stress disrupts nearly every system in the body. This includes the nervous system, the endocrine system, the immune system, and the digestive system. So that is a major, major impact. And we've heard stories about people going to the doctor and the blood tests come up good. The doctor every diagnostic they've run, everything is fine. The doctor sits down, holds you by the hand and says, is everything okay in your life? And the person maybe just experienced something traumatic in their life, maybe a loss of a loved one, some personal conflict in their family, or some other relationship issue, or some other form of PTSD. And then the doctor will say, okay, well, that makes sense now. Now I understand. So it's sad that it would take, a tragic event in a life for the doctor to be able to understand what's going on in a person's life, but it does illustrate just how that takes place. And maybe Dr. Prasad will be able to help us to understand that a little bit better. But statistically, 43% of US adults reported feeling more anxious than the previous year. And that's in the year 2024. We're in 25 now. My question to you, it's trending up. 2022 was 32%, 2023, 37%, 2024 up to 43%. Is there any reason right now that people might be feeling more stress? Maybe so. We understand the pandemic, but maybe there's other things happening on the world scene that's causing people to feel even more stressed now than ever before. And as of August 2024, the statistic is that 31% of adults worldwide identify stress as the biggest health problem in their country. And that's the highest percentage on record in recent years. Chronic stress can worsen pre-existing health problems. And that's when it's like you get to the breaking point. That's what this picture is illustrating, reaching that breaking point. And chronic stress, persistent stress in one particular area can cause a break. And all of this, as you can see here, according to the World Health Organization, may lead to an increase of use of alcohol, tobacco, and other substances. Another study indicated that heavy stress could shorten the life expectancy of men, 30-year-old men, by 2.8 years and 2.3 years in women. And this is kind of a sobering slide to me, that 18% of adults experience symptoms of anxiety, 21% experience symptoms of depression in the past 2 weeks. That was during 2022. And again, we all know what was taking place during that time period. A lot of things were happening, but that the impact extends on into young people. Young people experience tremendous amounts of stress as well. But here's where the impact globally is finally is realized. And this is according to statistics according to the World Health Organization. They estimate that 12 billion working days are lost due to depression and anxiety, and that costs some $1 trillion in lost productivity. Now, that part by itself is sobering, but when you start to quantify that and the impact of it and how it contributes to 120,000 deaths annually, that's when it really starts to send chills up and down your spine. They're connecting stress, workplace stress, to 120,000 deaths annually. And there's a reason for it. And again, Dr. Prasad can elucidate this a lot better. But this one diagram, this is an AI generated diagram, by the way. I think it kind of captured it, where stress from the brain perspective triggers the release of stress hormones, and that leads to adrenal glands producing adrenaline, epinephrine, and noradrenaline. And then that can have an effect on the digestive system, and that can temporarily stall and have an effect on breathing problems. And that can lead to heart problems, and muscles get tense, and all kinds of issues in the body. And then it's almost like I asked AI to illustrate what this flight or fight syndrome might look like, and it came up with this picture. And to me, that kind of well illustrates the turmoil that could be going on inside the body. So here's the you that's trying to stay alive, and yet this all this activity that stress is stirring up, it just creates a massive fight or flight syndrome that takes place inside the body. But before we introduce Dr. Prasad, I'm going to just maybe share with you maybe one testimonial that I believe well illustrates that Dr. Prasad's formulas have had a major impact, a very major positive impact on people's lives. And you may appreciate hearing this particular story. This is a young person that was under a great deal of stress in her life, and some of it brought on by PTSD, episodes of PTSD and other traumas and other issues. So let's hear from Sharon Witherspoon right now.
Sure. Here is Sharon. Hi.
Hi, Dr. Prasad and Jonathan. I wanted to say that, a lot of times people feel like, young people don't go through a lot, but I did. In my early 20s, I used to have severe pain, and I almost lost one of my two children, or they wanted to deliver her like 5 months early because I was in so much pain, but didn't know why I was in a lot of pain. And I was diagnosed with severe endometriosis. I had chronic pain day in, day out, and not natural bleeding that women go through. And I was also diagnosed with osteoarthritis. I had it really bad in my neck and my spine, and it crippled me. I was feeling like I've been electrocuted. Shocks just would go down my neck and back, and I couldn't move. And it would come out of nowhere at any given time, no matter where I was at. I was diagnosed with fibromyalgia. I had those, oh my God, from head to toe, I was in pain. Rheumatoid arthritis, and I developed PTSD. When I used to live in Houston, Texas, I was coming home one day from work, and like they got kidnapped, human trafficking. And from there, I developed what Freddie mentioned, agoraphobia, a fear or a form of anxiety. I didn't want to leave my home because I was afraid of that happening again. And I was placed on several different medications for anxiety, depression, insomnia, because I couldn't sleep. Like Freddie, just thoughts just running through my mind, fear, worries, day in and day out. And I just needed help. And I was telling my whole family, I have a large family, seven sisters and 5 brothers. And my brother Alex and the rest of my family was encouraging me to continue to pray and try to look for things, and they would be looking for things. And I never forgot the scripture that I read. In fact, I read it this morning. 1 John 5:14-15. It tells us, if you ask Almighty God, whatever you ask him, he hears you. And if your prayers are in harmony with his will, he will answer you. And so I continued to pray and ask for help, because I was in the bed all the time, constantly in a lot of pain and hurting. And I just didn't have a quality of life. And I was young, and in my 20s on up until now, I had continued to hurt. And so finally, when my brother discovered Dr. Prasad's products, he told me about it. I got on them. And I tell you, they work. When I got on the CBD, because I read what it's for anxiety, it's for insomnia, pain, depression. And those are things that I had, and I needed that. And so when I got on them, that's what I felt gave me my life back, because even today, I haven't even taken none of my products, including my CBD. And
Wow.
normally when it rains, because it's been raining all here all day today, either the day before, I start hurting so bad, head to toe, but no pain. And it's raining outside, no pain. Oh my God, I just was so happy that
Wow.
I'm not hurting head to toe. And I tell anybody, these products are the real deal. They really work. And Dr. Prasad, I just wanted to tell you, there's some words to a song that say, if you say my eyes are beautiful, it's because I'm looking at you. The world is looking at you, Dr. Prasad, and you are beautiful to us. We thank you for all the products, because they really, really help. I went through so much in my life, losing a lot of family members. I lost my husband, my parents, and 3 of my siblings, several of them due to cancer. And that took me for a loop. And I'll tell you one thing, being on the CBD and increasing it and all, it helped me, because I've been driving since I was 15 years old. And I was not, the last 8-9 years, I haven't been able to go outside and get in my car and drive my own car. And just last week, I went to get in my car. My brother came and gave me a jump, because I don't go many places. And he gave me a jump. He said, come on, let's go around the block. And normally if I drive out of, the neighborhood I live in, that's when my anxiety come on. And it's so bad. It mimics like I'm about to have a heart attack, and I go to shaking and sweating and going on. But I noticed that didn't happen. I drove out of my neighborhood, drove several blocks down the street, and I just tears just swelled up in my eyes, because I realized that this CBD is really working for me, and I might get my life back and be able to drive and be independent. You don't know how it feels to be independent and be able to get in your car and go wherever you want to go and not have, that hindrance, and to be able to get out your bed and want to be around people. I didn't want to be around people. I just wanted to stay in my house, perfectly happy staying in my house. But if I had to go anywhere, I had anxiety attack because of having to go outside of my house. But I noticed it's getting so much better, and I'm starting to have better quality of life. So I just want to thank you, Dr. Prasad, and I love you. Thank you.
Thank you. Thank you very much.
Oh my goodness, Dr. Prasad.
That's amazing. That's amazing story.
I'm practically in tears. All right, so just wanted to share that one story to kind of lay the foundation for this part of our discussion, and we'll give Dr. Prasad some time to maybe comment on this and help us to appreciate what has taken place here. But let me just formally introduce Dr. Prasad to our discussion. So you all know who we're talking to. But some of you have not ever met Dr. Prasad before. So Dr. Prasad was the world's first radiation biology PhD. So he graduated back in 1963, just finished the course up in what, 3 years? It was a 4 or 5 year course. He knocked it out in 3 years. So he became the absolute first one to do it. And his products have been awarded numerous patents. I say numerous because you can see on the screen it says 10, but that's 10 and counting. There's more than that since. He did some work for the government where they ponied up millions of dollars for him to do research to formulate a micronutrient. And the idea was to use that to keep soldiers on the battlefield in optimal condition. So out of all the vitamin companies on planet Earth, they all took a step back. Dr. Prasad took a step forward and said, I can handle this. And he did. He knocked it out the park. He was a professor at University of Colorado School of Medicine for more than 30 years, director of vitamin and cancer research. So he knows a little bit about the subject. He knows more about it. He's forgotten more than most of us know on the subject. Drop down a few lines there. You'll see he was invited to be a member of the Nobel Peace Prize nominating committee for candidates in the category of medicine. So they don't just extend that invitation to just anybody. So he's authored or co-authored some 33 books. I think it's up to around 35 now. Been published more than 250 times in peer-reviewed publications, and you can find references to him and his work in PubMed, some 450 references or more to that. So Dr. Prasad has been around the block a few times. So it's my pleasure, my privilege to introduce to our discussion now Dr. Kedar Prasad. And Dr. Prasad, we can't say thank you enough for your being willing to join us in days like this when many folks are only exclusively focusing time with their family, but you step away and you give us some of your time. So thank you for joining us, sir.
Yes, I always enjoy, Jonathan, being with you and with our engaged family. And so that's very interesting that you showed it, and you know why it happens. First, a stress in a young person could be, like you mentioned, varieties of reasons, external factors, and then, but sometimes also in diseases. For example, if somebody has a severe disease of any kind, Alzheimer, Parkinson's disease, or any kind, they also develop a stress, and they start saying again anxiety, depression, even hallucination. And then, of course, they have medication like Prozac and some other antidepressant agents that are also given to PTSD people. But what our issue was that how you can do it to reduce the anxiety, depression by non-toxic methodology. And we found that CBD is, to my knowledge, is the only agent which can solve the problem. And an example, you saw it. And the reason is because when you get anxiety, a lot of the biochemical changes occur in your body. And one issue is that serotonin level in your brain decreases, that you become, and then you start producing glutamate, and then become very hyperactive. Also, you reduces dopamine, and then you feel also depressed. And so because of all these things new from the literature, and for example, the person who has a PTSD from Army veterans, they gave one drug, what is called a serotonin reuptake inhibitor, to reduce the anxiety. And so when I was doing on developing CBD Boost, we found that CBD does a better job than any other prescription drug right now. They are doing it for decreasing, whether it's a Prozac or serotonin reuptake inhibitor or any kind of thing. The reason is because serotonin, the CBD is the only agent which can increase the serotonin level in your brain by two methods. One, it also acts as an inhibitor of serotonin reuptake, because once you get an uptake, then they get destroyed in the cell. So you block the uptake. But in addition to that no other agent has, it also acts as a stimulator of the formation of a new serotonin. So you bind with the serotonin receptor in the cell and increases the formation of new molecule of serotonin. So serotonin level becomes good amount, and that's why you feel relaxed and happy. In addition to that, it also stimulates the what is called a dopamine D2 receptor that temporarily increases the dopamine level. And dopamine level, as you know, and then you feel very happy. So this is a different mechanism. And third mechanism is also that it prevents the release of glutamate, which is very neurotoxic. And so you can see that how important CBD is in reducing stress. Because when you have a stress, you release all kind of toxic chemicals, and one of them is cortisol, which can damage all your brain, every organ in the body. And so I think it is very important that you reduce whenever you feel, whether you're young or old, doesn't make difference. And it is so non-toxic, CBD, that FDA has approved up to 750 milligram to be given to a children with epilepsy and has no toxicity. And so here is the CBD boost. You can see that. And CBD has no trace because it has isolated from a plant that has very little THC. And so after purification, and it was tested by third-party testing, has no contamination of THC. Is very important because CBD is non-addictive and does not affect, like THC is addictive. It can mess up your brain. But CBD has no such effect. There is no toxicity of any kind. And our preparation is one of the best. And isolated, there are many forms of CBD. You can buy CBD oil. They have all kind of junk. So we go for a CBD isolate, which is the best form and very effective form. You can see the effect with the girl was testifying. See, and
That's
so
pretty impressive.
I think. So if anybody has any question on this kind of issue, I will be glad to answer it. But of course, with CBD also very important is because oxidative stress, when you get anxiety and depression, you also body get stressed and then start producing more oxidative stress and inflammation. So if you take a micronutrient, for example, at least the EMF radiation, either in capsule or hydroform, that
Dr.
is
Prasad,
also
before
helpful.
you go on, Dr. Prasad, to talk about the other products, you mentioned that this is a CBD isolate. I've seen CBDs, they call them full spectrum.
Yes.
CBD, CBA, and all kinds of other things.
Yeah, it has a
chose
what
this
no, because somebody one time I reviewed a paper where they had a different preparation of CBD, and they found that the CBD isolate type of purified one is much more effective than the other forms. Although the paper claimed the other form is better, but when you see their data was totally opposite than what his conclusion was. So I pointed out this thing to David because he's the one who sent me that paper to review it. And so don't go for that one because sometimes and they were supported by the company who are making that product.
Right,
and
of course.
so they can make a conclusion something and then for example right now there's a good example you see so much commercial of the weight loss formula, Ozempic or Manjaro or semaglutide, many types of things. They don't say a word about toxicity.
That's right. Yeah, they may sometimes give you a little bit of a blurb on the side
Yeah.
effects, but it's normally
And
with
our is open book. We know, we point out if there's some problem. While I'm preparing, I make sure the dose is correct, ma'am. I make sure that it's 110% safe. Any product that I have developed.
Yeah, and we can attest to that. And Sharon's story there that you've heard that story before.
Yeah.
Where she's pretty amazing. She had a dramatic response to your CBD, the isolate, because this is really more like a CBD concentrate, more than anything. So it's the best part of the hemp plant, not the cannabis, not the marijuana.
No.
But
Because some of those
plant.
things like THC, for example, they can give you a temporary feel good because that also produces dopamine, but they are very addictive. One, and it affects your brain adversely.
Right.
And so I think, and CBD, many times people have asked that, somebody is working and they want to a drug test, will that THC comes? I said, no, there is no, because we have tested it, third party tested it. There is no trace of, but sometimes CBD, many people may consider it as a drug.
Right. Understood.
Yeah.
I got one hand here. Hayden, are you
Sure.
asking a question specifically about CBD? Or you're curious about something here, Hayden?
No, my question is about CBD isolate. What, if any, beneficial effect, would it have for pain, such as sciatica or osteoarthritis?
Yeah, I think, I just said that girl was saying that, I think that will reduce the pain. And so for that kind of pain, you may have to take a little higher dose of CBD. So I think those kind of pain, she has it too. And some other people have reported that if they have that kind of a pain, like you were mentioning it, and it should be helpful. So if you want to test it, try it.
So, is there a recommended therapeutic dose for?
No. I mean, because nobody has tested it, in a large clinical study with your conditions. But I mean, it is so non-toxic that you can very easily start with 200 milligram per day and then see how you feel. Maybe you will feel good. You can go up to 500 milligram without any problem.
Right.
Gradually.
So there's no toxic level, and
Gradually you can go very easily. But I think my feeling is that if you take 200 milligram daily, in a few days, you will see the difference in pain.
And it was Sharon, and one other story that we want to share. They were taking as much as 6 or 7 of the capsules multiple
6
times
and 7
per day.
capsule would be about 300
so-
milligram. Each capsule is 25 milligram.
Yeah, so they were taking quite a bit of it, multiple times throughout the day. So there's no toxic level to it, Hayden. You just titrate up.
Yeah, you just have to titrate your body and see how much you need, and wait for a few days before you change the dose. And so I think,
All right. Well, thank you. Well,
and then let us know after next time when we have meeting. Let us know how you feel.
all right, we'll do. Thanks.
Thank you for your question, Hayden. Ed or Joyce, do you have a question or comment on some observation that you've had with CBD?
Yeah, I really appreciate those mechanisms and how that works, and it does work. The mechanisms with us and our friends do work exactly as you explained. You were going to go into a little bit about the interactions of microdaily EMF and probiotic, I think. I didn't know whether you were going to get to that later, Jonathan, but I was very curious about.
Yeah, Dr.
Thank
Prasad's
you.
we're about to move on to that right now.
Thank you very much.
All right, thank you. Okay, so Dr. Prasad, I'm going to let you go ahead and finish what you were saying as far as this stress, because our focus here is on managing stress, and we know that your products have a huge impact in more than one respect. So we got a couple more slides here. Do you want to comment a little bit on how Micro Daily has an impact on stress?
Yeah, Micro Daily, because in a stress also your body increases the oxidative stress and inflammation, and because cortisol gets released, and so taking the Micro Daily will reduce oxidative stress. So your effectiveness of together with this the CBD, you will feel much better, and the chances of having an impact on any disease process, because stress can lead to all kinds of disease, from diabetes to cancer to everything. And so you can prevent those things because those diseases are mediated by increasing oxidative stress and inflammation. And so I think it is very important to have, at least, if you can't, if you have this kind of issue, I would suggest Micro Daily for sure, and CBD plus the probiotics and prebiotics, because that is in a stress, the intestinal dysbiosis, which means increased number of harmful bacteria in your gut increases. Stress will increase, further aggravate the level of intestinal dysbiosis. And so it is very important to correct them and maintain that way. Then you will see overall not only much better, but also reduce the risk of many chronic health issues.
So when you saw the AI generated info slide, infogram that mentioned all the different organs that are impacted by stress.
Yes.
So the combination of the CBD, micro daily, and the probiotic
Yes.
could potentially ameliorate some of the issues that are all being stirred up there, this fight or flight syndrome.
Yes.
Wow. Okay. Okay. So I would say that's about saying a mouthful there. Anything in particular that someone needs to know about those things? You heard it here directly from Dr. Prasad. Omega-3 is another one of his formulas.
But omega-3 again depend upon what is your immediate and what is your long-term effect. Immediate effect that we mentioned all those three things. But if you are concerned with the long-term, for example, while you are aging, and then you want to maintain an excellent quality of life. For that, the third, after probiotics, third most important thing is collagen peptides while you are aging. Collagen peptide is so important because one of the major function of collagen peptide is the maintain the structural integrity of all organs. When you lose collagen, as you grow older, you can observe in your skin because skin gets wrinkled. Well, also your brain gets wrinkled, kidney gets wrinkled. And when that happens, their capacity to perform normally decreases. And then you have all kind of health issue. And so that's why, but if you take for example, there was a clinical study performed among the 40 to 60 years old individual, normal individual, and they found that when they did MRI of the brain, they found a certain area of the brain was shrinking. And was shrinking with those individuals, their capacity, cognitive function also slowly decreasing. Then they did a clinical study. They supplemented those individuals. This was a normal individual, not with any disease, normal individual. And they found that if they supplement the same group of individuals with the collagen peptides, only 5 grams a day for 90 days, then they did MRI again, and they found that the structure that was deteriorating in the brain improved, the cognitive function improved. So this is a very good example how it is that to maintain the collagen level all the time in your body. And as you know, that our collagen is the best because it also has an inhibitor of collagenase, which destroys collagen. Because as you grow older, your collagenase enzyme increases, and that decreases the collagen from your skin, from your all over the body. And so the third most important thing is the collagen. And collagen peptide is also, when you have this GLP boost we have, and collagen peptide is one of the few agents, this is non-toxic, that inhibits the enzyme called DP4, which destroy the GPL1, which destroys GPL1. And so it is very important to have collagen peptide. Collagen peptide also improves the flow of insulin from the pancreas to the blood by inhibiting the enzyme called DPP4. So collagen peptides have many very important functions in your body, long-term, acute term, short-term, long-term, and so it is a must. But some people can't afford it, so that's a different issue. But if you can, then fourth one is the omega-3. Omega-3 has two components. One is DHA, one is EPA. DHA is extremely important for brain function, and EPA is extremely important for your heart function. And DHA is so important that 40% of fatty acid in your brain is DHA. And DHA is get easily oxidized. So if your body have a high oxidative stress, in brain, whatever a smaller amount of DHA will not function very well. Then you will have all kind of neurological issue. And therefore, it is very important to have replace the damaged one, replace with the new one, which is omega-3, and then you will be happy. Another people often ignore it, this is for older people, if you are 40 year older. But younger people know that as you grow older, your body capacity to produce digestive enzyme decreases. And when that happens, then you can't digest food, you can't even digest micronutrient as good as if you are healthy. And therefore, it is very important for older people also have a digestive boost so that your gut is totally healthy and they can now absorb all the nutrients you eat, micronutrient that take, any supplement you take, and you will feel much better.
That's it. That's it. Well, that's a mouthful, Dr. Prasad. Thank you very much for sharing that. And I'm hoping that everyone who's on listening now understands that this litany of products that Dr. Prasad has mentioned, this is all about helping our body to ameliorate stress.
Yes.
Because that can exacerbate any health problem. And although we're not talking about a cure or treatment for any disease, we certainly can help the body to do what it is designed to do.
Yeah.
So I'm going to pause here for a second, Dr. Prasad, and I think we had a couple more stories that we want to share with you. Dolores, I'm not sure if you were able to get your daughter.
She's on, Jonathan.
Barbara's here?
Yes.
Okay. So, Barbara, if you could raise your hand so I can find you here. We'd love to hear your story. Oh, there she is, Barbara Atkins. Okay.
Hello.
Hey, Barbara, thank you very much for being willing to join us here. We heard your story once before, but go ahead and just share your story as if you're sharing it for the first time.
Okay. Well, I deal with anxiety a lot anyways, but it was made 50, 100 times worse when our son was killed in 2021. He was killed suddenly in a trucking accident, and my anxiety and my stress went off the Richter scale, if you could just imagine, and taking medicine, they went through different medicines. You mentioned Prozac, I went through Xanax, I went through just a lot of different medicines that it wasn't working for me at all. It would work a little bit and then it would stop. And, my mom always talked to me about taking the natural products, which I know about them anyway, but during that time, I really needed something because I wasn't sleeping. My anxiety and my stress had my blood pressure high. I had no quality of life because, losing a child, losing anyone in death hurts, but losing a child, that's one of the worst pains you can experience. And I was just letting my mama know, I'm at my wit's end. I don't know what else to do. And she said, well, I'll give you some of this CBD to take, which I had already been taking the micro daily. So she said, I'm gonna give you some of the CBD to take. And I was like, I don't know about that because my blood pressure already high. I don't want it to make it no higher. She said, it's not gonna make it higher. And I did start taking it, and it lowered my blood pressure. It started, it didn't happen automatically, but the more I took it, and kept the routine up, it helped along with the other products that you take. And my blood pressure started coming down to where it needed to be. My anxiety and my stress, the CBD, I know that's what helped because before then I just couldn't function. I didn't want to do anything. I just wanted to stay home and, under the covers. But this helped me to start trying to get back to some sort of normalcy. Things would never be normal as they were before, we lost my son, but these products, I can attest that they work. If you take them like you're supposed to, they work. And eventually they do trump your medications that you're taking. You might can't come off all your medications and you might can come off them all at once, but your dosages can get lowered. And I was letting my doctor know what I was taking, and he told me, just keep it up. I haven't had to call him for refills for, to get my anxiety increased, my anxiety medication increased, even though sometimes I still have to take something, but I know the CBD was doing the job that it needed to do. And right now, taking the probiotics along with the micro daily, that helps with so many other things besides anxiety and stress. It's just a long list of things that it helps for. But the CBD, that stress is a stress reliever for sure. If you're having stress or anxiety about anything, it helps. And if I can take it after losing a child and it helps, I'm quite sure it can help anyone else as well.
Thank you.
Barbara, thank you. Thank you very much for being willing to share your story. Very sorry for your loss. And how long ago would you say that was?
He was killed in 2021.
Sad.
So this
September
is
September the 16th. So it's only been 3 years.
Yeah, this is fresh and very, very, very raw.
It's very it's still it's sometimes it's like it just happened, It's not, so it's not like it's been years ago, and it's just I still deal with this every day.
Mhm.
So having something to help me, I mean, that's really big, because like I said, if it wasn't for that, along with some other things, I just don't know how I'll be able to make it. And especially for I didn't have we didn't have preparation for it. It was just, he was in a truck accident. He was a truck driver of an 18-wheeler, and the tire blew out. So it just happened, only 26 years old. So that's a lot to deal with at one time,
Oh, of course, yeah.
Yes.
Oh,
So
yeah.
Dr. Prasad, your products, my mama lives by them. Miss Levat lives by them, and she's always telling us about taking them. My husband done started taking. Before he was gung ho on, no, I'm not gonna do it, but he's taking them now, and he's talking to other people about it. So
Yeah, good.
It's working.
Thank you.
All right.
Thank you very much again.
You're welcome,
Barbara.
All right.
So
And this is Lisa, and I'm gonna cut in. She does live by it. This is the other
who's
daughter.
that now?
Lisa, this is Dolores' other daughter.
I'm trying to find you. Oh,
You might can't find me, but I was just saying she does live by it.
okay. All right. Okay. Very good. Thank you for reinforcing that. The whole
Thank you,
family
Dr.
can
Prasad.
attest that
Thank
this is
you.
real.
Oh yes, including the grandchildren and the great grand.
So the whole family is benefiting from your products, Dr. Prasad. So you want to comment on this, because we're talking about major grief there. That's major PTSD, Dr. Prasad.
Yeah, and again, a classical example of PTSD, one of the drug they use it, I forgot the name of the drug, but it is a serotonin reuptake inhibitor. And as I said, CBD does exactly the same without toxicity, but the FDA-approved drug has some toxicity. But, all Prozac and everything works some. It is not that it's totally ineffective. It works some.
Yeah.
It has
Yeah.
toxic effect, side effect.
Yeah.
And it becomes, later on, you keep increasing the dose, but it becomes ineffective.
Well, I want folks to, if they don't get anything else, and it sounds technical, but listen to what Dr. Prasad said there. Serotonin reuptake inhibitor. Okay, serotonin reuptake inhibitor.
Yeah.
That is a scientific fact. That's what's happening, which behaves exactly the same way that pharmaceutical drugs for things like depression and anxiety work.
Mm-hmm.
CBD is
PTSD,
performing the same function. The only caveat, there's no side effects.
Yeah.
That's just amazing, Dr. Prasad.
That's amazing. I know it is amazing to me too.
Well, and I think that all of us need to just recognize that I take two every day, two every night. So
I too, myself too, I took every day.
I am not, there's no way in the world I'm not going to have something that's going to support me when it comes to stress,
Yeah.
because it's a nonstop thing. And for any of us to think that we're immune to it, you're kidding ourselves. So,
Yeah.
so you want to get the CBD and get on that. I take the brain boost every day.
Again, brain boost is also very important. Again, not for everybody, but those people who feel that
No, I
brain
think it's for
boost,
everybody, Dr.
has
Prasad.
brain-
Everybody.
Yeah. If you can afford it, then it should take everybody after 40 years. I take every day.
Yeah, absolutely. And there are some people who need the sleep
I
boost.
take sleep boost every day.
It'll put you in a coma, right? You take that with everything else, but
Yeah,
you will get some
right.
deep sleep now.
Yeah.
We'll get deep sleep. So listen, folks. Here's the nuts and bolts of it. The core four, if you bought each of the items retail, you're going to pay more than $300 for them. If you buy it in a bundle, Engage Global has subsidized your health.
Yep.
And not only are they giving it to you at a massively reduced cost, because even at wholesale, it would be about $250.
Yeah.
So now it's below the wholesale price when you buy it as a bundle. And right now, if you subscribe, Dave Nemelka has Engaged Global has said that after your fourth order, let's say this is the only thing that you order is the Core 4 and say CBD, the CBD boost. Let's say that's the only thing you order. That would be somewhere around what, $270, something in that area. Then Engage Global, after your fourth order, is going to give you rewards points that's equal to whatever your lowest order is during that 4-month time period. So if you stick with that for 4 months, as Dr. Prasad recommends, you're going to get a whole month of it for free. So after your fourth order, so you really can't go wrong with that. So that just really reduces your overall cost of your own health, managing your own health, to just a fraction of the cost. This is the lowest bundle that Dr. Prasad recommends is the basic bundle with the micro daily and the probiotic daily. So this is the bottom line you want to do. So $65. The subscription price is $110. So that would be the if you can't go any better than that, but you still want to add the CBD boost to this. And when you add a boost, CBD boost or any other boost, Engage Global will give you at the very beginning, the very first boost you add on, they'll give you $10 off that one.
Yeah.
The second boost, they'll give you $15 off that one. The third boost you add on, they'll give you $20 off that one. And every boost after that, they'll give you $20 off. So you can't beat it when it comes to this company wanting to help you with getting access to Dr. Prasad's product formulas. But that's the list of them. You can see all three of them there, the basic bundle, the premium bundle, and the core 4. And you can add any other boost, including CBD, to any of these bundles that you see. So just get back to the person who invited you to this discussion, and they'll help you sort through all that. So if you missed something that wasn't really clear, they can help you with that. But one final word that we want to pass on to you guys is talk to your doctor before you do anything. But my recommendation, Dr. Prasad's recommendation, is don't ask a pill, potion, or lotion to do for you what you could do for yourself. Walk, get moving.
Yeah.
Your lymphatic system demands that you get moving. Your body demands that you get moving.
Exactly.
Don't expect any of Dr. Prasad's formulas, pill, potion, or lotion to do for you what you could do for yourself. Change your relationship with your couch. Start moving. So we highly recommend that you do that. But get back to the person who invited you to this discussion, and they can help you further. So that kind of brings us to the end of our discussion here about April being the Stress Awareness Month. So I'm kind of glad that they make these National Awareness Month things too, Dr. Prasad. But Jeff, any final words there that we need to make sure that folks know about? Because we were talking about this digestive boost there. Tell us a little bit more about what's going on.
Absolutely. So between now, this weekend and tomorrow night at 6 p.m., there is a flash sale going on. Buy 2 digestive boost and get a probiotic daily for free. You cannot get the daily formulas on anything but something like this. Dave's never done it before. He's never done it before.
Yeah.
But if you look at that, until it's right there, April 21st. Oh, look at that. 16th through the 21st. That's tomorrow night at 6 p.m. We have that opportunity. Save $40 right now. So I want to just add that right there at the end because we're still running right here. Call customer service tomorrow. Get it on order. In fact, we're buying multiples of those. With just going through Easter Sunday dinner. I'm so glad that we had the digestives.
Yeah.
I'm taking extra. So
Hold back. Take GLP-1. Whatever it takes. We didn't even talk about GLP-1 Boost as far as weight loss and anxiety and stress. So we didn't even talk about the GLP-1 Boost. But you got to throw that in there. So I got to remember to make sure that I add those into the slides so we can always get a comment from Dr. Prasad on that. But would the GLP-1 Boost be helpful when it comes to stress?
we've seen it. It's lowering that cortisol response.
Yeah. Cortisol is a classical response.
Okay. So lose weight, folks. All right. Well, thank you very much again, Dr. Prasad. Jeff.
Thank you.
Thank you for all that you do. Dr. Prasad, we can't thank you enough, sir, for everything that you bring to the table for us.